Hello, my name is Darcy Roake. I found clinical pastoral education to be incredibly powerful. And after doing a unit of clinical pastoral education at Massachusetts General Hospital, I became a per diem chaplain there. And then eventually in the next year, actually then became part of the advanced interdisciplinary clinical pastoral education. I found that healthcare had a negative effect on the overall health of the patients that I was working with. And when I say overall health, I take a description that Emily Towns, a womanist theologian, uses, which is the idea of both of the emotional, the spiritual, and the physical, that all of those actually interact for health outcomes. As a chaplain, what was my role? Was my role more specifically, if you're going to take the initial definition of pastoral, was it really more focused on the individual and the family system? Or was it broader? Was it something like a prophetic role to work more confrontationally on larger systems? The prophetic and the pastoral must come together, because that is actually working for the whole of the patient. You are working for the individual patient and their family when you're advocating for the change in the larger system. I engage both liberal and liberation theology to create a liberatory healthcare theology. This is actually not something particularly new. It is new in terms of healthcare theology, but this is something that many Unitarian Universalist theologians have actually also been working with as well. The idea of what are the tensions and what are also the connections between liberal and liberation theology. And specifically in terms of clinical pastoral education and chaplaincy, it really came out of a liberal theology and also a Unitarian understanding. Dr. Richard Cabot, who I speak about in my thesis, was a Unitarian in Boston, and he began the program at Massachusetts General Hospital, as well as the social work program at Massachusetts General Hospital. So what I really took in many ways from liberal theology was the larger sort of universalizing and connections between people, the ways of trying to find connections. I appreciated that in liberal theology. However, I also appreciated the critique, and specifically American liberation theology, of really looking at context, because most of the liberal theologians, especially around, say, the social gospel movement, which talked about social advocacy and change, were white Protestant men. And liberation theology in the United States really looked more at specific communities and what are their theological needs. As a Unitarian Universalist, I feel it really holds a lot of the values that I find important, specifically how to both be present for individuals and their spiritual and emotional journeys, as we talk about in our principles, and their search for meaning, as well as how to advocate for larger, meaningful change and work towards justice and peace and advocacy. I have had personal relationships with individuals that this has negatively affected. I see the ways in which lack of healthcare access has had profound effects on individuals. And from there, that makes me even more engaged with continuing with healthcare access.